I'm Laura Ternent. I'm a senior lecturer in health economics with the Health Economics Group based at Newcastle University, and I'm here to talk about how you would present health economics sections of your grant proposal. Next slide, please, Steph. So in terms of an overview, we'll give a very brief overview of what the Health Economics Group at Newcastle does, what we're interested in, where our expertise lie. We'll talk a little bit about what health economics can add to your proposal, some top tips in terms of integrating health economics into your grant applications, and then I'm more than happy to answer any questions either now, next week, next week, whenever we meet next, or via email, whichever you prefer. Next slide, please. So in terms of the Health Economics Group, our aim is to conduct internationally relevant applied research using the very best and very latest methods, and we're often at the forefront of those methods developments. We organise our work into 4 or 5 main areas, and that includes things like decision making and priority setting, whether that be at a local or national level. So it might include techniques such as cost effectiveness analysis or economic evaluation more broadly, programme budgeting, marginal analysis techniques, discrete choice experiments, and so on. We're also interested in applied microeconomic methods to understand motivations of behaviour. So this is often individual level data of large data sets. The largest element of what we do within the Health Economics Group is economic evaluations, either alongside complex interventions or in complex settings. So this will often be economic evaluations alongside complex trials. Things like cost effectiveness analysis, cost per quality analysis, and so on. And then outcome measurements, outcome valuation. So how do we measure and how do we value health-related quality of life measures such as the quality adjusted life year and others. And then finally, health and health-related evidence synthesis. And Fiona's nicely covered that already, so I'll leave that one there. Next slide, please. So in terms of health economics and the RDS, what is it that we actually do? Well, we provide the specialist advice in terms of health economics to the RDS. So all requests for health economics advice will come either to myself or Joe Gray, a colleague at Northumbria, fellow health economist, and we'll then allocate those requests on the basis of expertise. So over the last few years, we've provided advice across all range of NIHR programs, from public health research, program grants, fellowships at all levels, charities such as the British Heart Foundation, the MRC, Wellcome, and many, many others. So we've provided lots of advice to grant applications across a whole range of different funders. Next slide, please. So in terms of grant development and health economics, I guess, some of the top tips or take-home messages. The key thing for us is to engage ideally with a health economist really early on in the process. And ideally that would be via the RDS. And at the design stage, so really early on when you're thinking about your proposal, you're thinking about your project, engage with us really early. The idea of sort of bolting on what others might call piggybacking health economics onto sort of the end of a project or the 11th hour isn't attractive to funders because it's not coherent and they see through it. It's not attractive to us as researchers or health economists because we can't do the best job that we want to do. So ideally you would embed it from the start. But we also recognise as researchers that sometimes things happen last minute, so we will always try to be as responsive and flexible to those sort of last minute requests. But ideally it would be from a very early stage. I guess the other thing to say about health economics is that where there is a substantial element of health economics, you're more than likely going to need a health economist as a co-applicant on your project. But also that there isn't a one-size-fits-all approach to these things. There's lots of different economic methods, there's lots of different types of research proposals out there. So it depends on the scope of the work, whether health economics is a substantial element or not. That in part depends on the funder, so whether they're willing to fund health economics research. But it also depends in terms of the stage of the application, and we'll talk about that in the next slide. Next slide, please. If we took just one example of the NIHR HTA, Health Technology Assessment Programme, if health economics is a substantial part of that work, and often is, you would need to embed or thread health economics through the entire document, the entire proposal. And that would include your research objectives, which would include a health economics research objective. It may well even be part of your primary objective, particularly if it's a randomized controlled trial where you're looking at the effectiveness, but also the cost effectiveness of an intervention. You would need to include economic evidence, or often the lack of that economic evidence, in the existing research summary. Again, another really good reason to engage with us early so we can help sort of formulate that section. Health economics would be included in the outcome measures and data assessments, but also crucially their timing. Often when I'm reviewing these type of applications, people miss out the timing of these assessments. You would include economic outcomes under primary and secondary outcomes as appropriate, again, threading it through the document. There'd be a separate section on health economics methods, so what it is you're doing, when you're doing it, but also the analytical methods, how you're analysing the data, how you're handling missing data, and so on. I think the key issue here is just to embed and thread it through your entire document, from your scientific summary to your plain English summary, right through to your research plan, if health economics is a substantial element of your research. It's also important to note that, particularly for the NIH, but for other funding bodies as well, a health economist will be on the panel, and the application will be reviewed by at least one, if not two, independent health economists. So you should be writing that in mind. Next slide, please. I guess some take-home messages. It's important to justify why health economics is important. It can be costly, just in terms of people's time, how much it costs to actually integrate health economics into an application. So it's important to justify why that's important, why it's good value for money. But it's also important to justify, if you're not including health economics, why it's not important. That may come down to the funder or the funding envelope. It may well be that you're going to somewhere like RFPB and health economics just simply isn't appropriate, or it's out with the funding envelope. But again, you need to justify that within your application. You need to be able to justify the methods that you've chosen and to be able to demonstrate that you know what the alternatives are. And this is particularly true if your methods are unusual or if they don't follow guidelines for best practice. You need to demonstrate why the method that you're using adds value. For things like early applications or expressions of interest, you need to be able to reassure the panel that your methods are appropriate and that you have the expertise and the track record to deliver that. Now, that's not always that easy in an expression of interest, particularly in health economics, where you might only have 2 or 3 paragraphs to play with. And often PIs and CIs might want to sort of cut those 2 or 3 paragraphs down even further, so that's a real skill. I think the overall advice really is to seek advice from a health economist early in the process. I think it's really important. Next slide, please. In terms of the health economics group and our input to the RDS, what we're aiming to do is to add value to research proposals, to your research proposal. What we're hoping to do is to answer important, interesting, policy relevant questions using economic methods, but we're certainly not hoping to leave you like the 2 guys in the cartoon, where the drug itself has absolutely no side effects, but the number of health economists needed to prove its value may cause dizziness and nausea. We're not trying to leave anybody feeling like that. Thank you.
Thanks very much, Laura. That was excellent. Do we have any questions from the group about health economics or statistics? Aditya is still here also. So there's one question in the chat about, can we access support from